And then I'm going to share my screen. This is our Suffering Sleepless Nights program. And we're so honored to have Dr. Francois Roux, who is here with us from Starling Physicians. And before she introduces herself further, I'm going to share my screen if I can do that. Right.
That's good.
And Dr. Roux is part of the Division of Pulmonary and Critical Care and Sleep Medicine. And we're thrilled to have you. Can you give us a little more information about what you do with Starling Physicians?
Yes. So thank you so much for inviting me. So I'm a sleep physician. I'm also a critical care and pulmonary physician. So I've been practicing sleep medicine for about 20 years. So I enjoy seeing patients every day. And today thank you so much for inviting me to this program. And today I wanted to talk mainly about obstructive sleep apnea, because it's actually the most common sleep disorder. So I wanted people to be aware about this medical condition. So I don't know if I can put next slide or you have to do it.
I think
right?
I have to do it.
So what is obstructive sleep apnea? You can see on this screen is if you look at the airflow, usually we breathe during the day, and when we sleep, despite sleeping, we breathe at night in a normal fashion. But people who have sleep apnea, they stop breathing during the night. And the definition is that they stop breathing at least for 10 seconds. And because of that, you can see that it's because there's obstruction of the upper airways, and that's why the flow stops. And you try to fight this obstruction. So there is some effort, as you can see, on the rib cage, in the abdomen, to try to overcome this obstruction at night. But because you stop breathing, of course, your oxygen will go down, and that can lead to various changes, like it disrupts your sleep, your brain waves, it make your blood pressure goes up, whereas usually at night, you are supposed to have a lower blood pressure than during the day. And then you resume breathing, and then you stop breathing again. And that, of course, lead to disrupted sleep, and people can feel, tired and sleepy during the day. So next slide, please. For the next slide.
Is it not up there?
No. Oh, yeah, here, now it is. Oh, just the previous one. Thank you. So just to put things in perspective, as I was saying, that obstructive sleep apnea is the most common sleep disorder that actually sleep physician and even primary care encounter. It is actually more prevalent than asthma. And you can see that in a recent study in the general population, and we define sleep apnea as people who stop breathing more than 5 times per hour, it affects like 33% of men and 17% of women. If you are sleepy, then it's about 14% of men and 5% of women, in addition to, stopping breathing more than 5 times per hour at night, have sleep apnea. So it's very common, as I said, more common than asthma. And if you are obese, then the prevalence is really high. So it's very common in people who are obese. So it's something to keep in mind, if you snore and your weight is high and you don't feel well during the day, it's something you should talk to with your primary care. If I could have the next slide, please. So weight is definitely a major risk factor for stopping breathing at night, for sleep apnea. And that's because also fat can accumulate in the neck and change the shape of the airways, so making it more prone to collapse at night. And you can see that even a 10% weight gain can increase your risk of developing sleep apnea by 6-fold. And it's estimated that nearly half of people who have sleep apnea, it's due to obesity. Yeah, nearly 60% of sleep apnea patients, that the sleep apnea is due to obesity. So keeping weight under check is really important, or losing weight, if you are overweight or obese. Next slide, please. So except the weight is the major risk factors, but there are also other risk factors, because sometimes we see people who are thin and yet they have also sleep apnea. So being a male is a risk factor. Women are protected by the hormones until they reach perimenopause and menopause. And it's felt to be because of the lack and decrease of estrogen level, and that increase your risk to have developed sleep apnea. Age, of course, nothing comes, nothing gets better with except wine, maybe, when you age. So as you age, you have, it increases your risk also of having many medical conditions and gaining weight, and also having sleep apnea. If your thyroid is not well controlled, it has an issue and it's not well controlled, your balance of hormones, that can also increase your risk for sleep apnea. Alcohol, I think often patients say, oh yes, when I drink alcohol, I notice that I snore much louder. And indeed, alcohol, will relax the muscle of the upper airways and contribute to worsen snoring and also worsen sleep apnea. The same thing for sleeping medication, especially, or anti-anxiety medication, also relax the muscle and then can increase the risk for sleep apnea. People who have anatomical abnormalities, so who have obstructive lesion of the upper airways, that can promote sleep apnea, or if they have a big goiter that can, push on the airways. There's also ethnicity. So people who are Asian, due to just the anatomy, the anatomy of the face, have higher risk for having, sleep apnea. And then there are, some genetic factors. There are some family where, oftentimes the father or the mother may have sleep apnea, and we always ask about that. And then people who are born with some abnormality of the face or genetic condition that promotes sleep apnea. So next slide, please. And you can see here when I talk about abnormality, like, this man has a very small chin and it's a little backwards compared to the rest of his nose, so it's not well aligned. So it basically narrows his windpipe, and that is also a risk factor for developing sleep apnea. Next slide, please. And also the anatomy inside your upper airway. So you can see here that this person has a very large tongue. You can actually even see the teeth indentation on the side of the tongue, because the tongue is large and the teeth are pushing on it. And then people who have, a low-lying soft palate, which is the curtain in the back of your throat, So all that can predispose to your airway, your windpipe closing at night. So next slide. And basically what happened is, usually it's a balance of forces. So we have things in our body that promote for this airway to stay open, but then other factors like weight, as I said, that promote airway collapse. And what happened is, then you can see that behind the tongue, that's where things can collapse. And basically there are even different, sometimes many sites of obstruction, but that promotes that you stop breathing at night. So next slide. So how do people present, and what should you be worried about? And if you, to be concerned that you might have sleep apnea. So if you snore loud, that should raise, suspicion for that. To the point that sometimes your bed partner says, I can't sleep, you snore so loud, I need earplug, or sometimes the bed partner has to move out of the bedroom because the snoring is so loud and they can't sleep. If the bed partner sees that that you stop breathing, so they hear loud snoring and then suddenly silence and then snoring resume, that should also be a red flag for there's something wrong. It's not normal to have breathing pauses at night. Restless sleep, so people move a lot in their sleep. And of course, because of the sleep fragmentation that happen because of the sleep apnea, if you feel sleepy during the day. So if you sleep 7 to 8 hours at night, you shouldn't feel sleepy during the day. If you need to take a nap, or if you, when you watch TV or read a book, you fall asleep, that's not normal. And you should be evaluated for that. Also, if you wake up in the morning and you feel your sleep has not been refreshing, or if you have headaches in the morning when you get up, and the headaches are usually due to the fact that when you stop breathing at night, your CO2 goes up, it makes the vessel in the brain get a bit bigger, and that's what creates headache. And it's usually headaches in the morning, and then it disappears during the day. It's not like you have a headache all day long, but it's just when you wake up, and that also should raise, suspicion for that. Some people may have also short-term memory loss. Why is that? Well, we know now that sleep is very important for memory consolidation. And if your sleep is disrupted during the night because you stop breathing, some people can experience like a short-term memory issue, or even focus or concentration problem that they didn't have before. That could be also a sign. Or sometimes, mood disorder, like feeling more depressed or not well, that also, could be a sign that your sleep is not normal and you may have sleep apnea. So what do we look for when we see a patient? So if the weight, as I said, is high, if people have a large neck, more than 18 inches for men and 17 for women, that also should raise suspicion. If people have high blood pressure, because as I said, at night, it's usually a time where your blood pressure is low, and people who have sleep apnea at night, the blood pressure goes up. And if the sleep apnea is not treated, that can lead to developing hypertension. So people who have high blood pressure and it's not well controlled and they are overweight or obese, they should also be concerned that they may have sleep apnea. If they have, like I showed you, this man with very small and lower jaw and back, or if they have very, all these anatomical abnormalities. So next slide. So women, men typically present, they snore loud and they feel sleepy. Women can present differently. They're less likely to report that they snore loud or that they stop breathing. And it's interesting, but oftentimes, women are they are careful about to see how their spouse sleep and if they snore, if they stop breathing. So the wife always, oftentimes would say that to us, but it's interesting that men, they never pay much attention to how their wife breathes at night. But so women are less likely to snore or to stop breathing, and they are more likely to present like, oh, I am tired, or I feel down, or I feel a bit depressed, or I have a headache, or I wake up a lot during the night on and off, and I'm not sure why. So to present more with kind of insomnia, like, oh, I wake up and my sleep is disrupted, I have trouble falling back asleep, and I don't know what's happening. And so in women, that should raise suspicion. And again, they present differently. And the risk is higher as after menopause. Yeah, next slide. And why is it important to try to, determine and diagnose sleep apnea? It's because sleep apnea, if it's untreated, have been associated with a lot of medical issues. So it can increase your risk of developing hypertension by nearly threefold. Even after you control for things that can increase your blood pressure, over problem like weight, based on weight, having a high weight can increase your risk of blood pressure. But even after you control for other things like that, by itself, sleep apnea increases your risk of developing high blood pressure. Another study done at Yale, actually, by Dr. Yagi, has shown that obstructive sleep apnea is also an independent risk factor to develop a stroke. There is nearly a twofold increased risk of stroke if you have untreated sleep apnea. And right now, actually, we are doing a trial it's a national trial looking at people who come to the hospital with acute stroke to determine if they have sleep apnea, and if they do, treating the sleep apnea and trying to see if that improves the stroke, the recovery from the stroke, and also if it decreases the risk of recurrent stroke or cardiovascular problem. Because of the sleep disruption at night, your cortisol is increased because you wake up on and off, or your brain wakes up, and so your cortisol level goes up. And we know that cortisol is associated with increased blood sugar, so untreated sleep apnea also increase your risk of developing diabetes down the road. It can increase also the risk of developing coronary artery events, and also atrial fibrillation, which is a cardiac arrhythmia. So people who wake up, and sometimes they can even feel at night they have their heart pounding or beating very fast, and it changes pressure in the heart, creates some remodeling there, and with time also increase the risk of developing atrial fibrillation. And that's why oftentimes cardiologists will actually, for patients who snore and have newly diagnosed atrial fibrillation, they send the patient to us to make sure they don't have obstructive sleep apnea. So next slide. So how do you diagnose obstructive sleep apnea? So in the past, and then still now for some patients, the traditional model that you were having a sleep evaluation and you were going to the sleep center to have your sleep study. And then if you had sleep apnea, you were going back to the sleep center to be put on the machine and I will talk about that as a treatment for the sleep apnea. This is the best test. And it's, you at the sleep center, you spend one night, nothing hurts. They just monitor your breathing, your heart, the movement of your chest. And it is the most sensitive test, so the best test to detect sleep apnea. And actually Medicare pays for that test. What has happened over the years is that now they have developed a home sleep testing model. And that is more for people who have no medical other condition too much, or just maybe high blood pressure. And most of the commercial payers, because it's cheaper, they require first, and they prefer that the patient first has a sleep test at home. So people like it too, because it's more convenient. They don't have to go any place. They just come pick up the device, and then they go home. They put it one night on them, and it's a couple of wires you put, and it's easy to do. And you bring back the device the next day, and you are done. Sometimes it may be not sensitive enough to detect mild sleep apnea. And then in that case, then we still have to send the patient to the sleep center. But commercial insurance, that's what they want first line. They want the home sleep test. So next slide, please. So once you have diagnosed the sleep apnea, how do you treat it? So as I said, weight gain and obesity and being overweight is a risk factor for sleep apnea. So weight loss can improve sleep apnea. So weight loss is one of a strategy. We know that it's hard to lose weight and that it takes time. So if you have significant sleep apnea, or if people are sleepy who have a medical or other medical condition, then CPAP therapy, which is basically it's a device you put with a little mask, which can be with a nasal pillows, a nasal mask, or a full face mask. It gives you air, pressure in your airways, in your windpipe, to open your windpipe at night so they stay open. And I'll show you a picture. Another type of treatment could be the oral appliance. So if you have mild sleep apnea and your weight is not too high, that could be an option, and I'll show you pictures. Surgery, and recently you probably saw a lot of, or seeing on the TV or on the highway, there's a lot of advertisement for this Inspire or hypoglossal nerve stimulation. So that's another option. So if you could, next slide. So weight loss can help. It can decrease the sleep apnea severity. And the good news is even a 10% weight loss can decrease the number of times you stop breathing by a quarter. So it's always worth doing. I always recommend to my patients, try to lose weight. But some patients, you know, despite improvement and weight loss, some may not have complete correction of the sleep apnea. Of course, you lose more weight if you undergo bariatric surgery, and that's the most efficacious treatment, especially for people who are very obese, you know. But of course, it's a surgery, you know, so there are always risks with surgery, but it works better than, of course, dieting. So next slide. So that is the continuous positive airway pressure. So you can see on the left panel that, you know, behind your tongue, there is obstruction. There is no flow going. You can see the tongue is abutting the wall there. Whereas when you put the CPAP with a mask, it pushes air, as I said, it acts as a pneumatic splint, and it keeps your airway open. And you can see that now the space behind the tongue is open. And that helps. Can you, next slide, please? What it shows is that CPAP is the standard treatment. It's actually the gold standard treatment for most patients for sleep apnea. It can abolish snoring, eliminate the apnea, the breathing abnormality at night. It restores a normal oxygen level at night, and then it improves your sleep architecture, meaning your sleep is more sound, and because your sleep is not disrupted all the time by the fact that you stop breathing. And so you feel better the next day. And oftentimes patients will tell us, oh, it changed my life. I was falling asleep all the time. I was nearly falling asleep at the wheel, and having untreated sleep apnea in patients who are sleepy, there is a higher risk of car accident. So that is something that is, you know, also very important to recognize, because if you feel drowsy while driving, you should really talk to your primary care or see a sleep doctor, because that's really abnormal, and you have very high risk of having a car accident. They found that people who have sleep apnea and are sleepy, it's actually when they drive, they can have worse driving than a drunk driver. So it's something to take very seriously. And treating the sleep apnea really helps decrease your sleepiness in the majority of the cases, and your fatigue, and people are not at risk to have, you know, car accidents. So next slide. Here, it's one of the mandibular advancement device, which is an oral appliance. You can see on the picture on the left, again, that the tongue fall behind and block and obstruct your airways. And on the right panel, you can see that this oral appliance, what you can see here, like Respi Blue, but there are different types. It moves your lower jaw forward and pushes it up and opens the space in the back of the throat and restore normal breathing at night. Only some qualified dentists do that. So it's not something you can buy on the internet or have even your own dentist that makes for you. You need a dentist who is very experienced into having this device, because they are molded on your teeth and they need to advance your lower jaw. So it needs to be really a specialized dentist doing that. Next slide. And then I wanted to talk about that because there's a lot of patients come and they ask us about that because there's a lot of advertisement on this little device. What it is that, you know, this muscle is actually the genioglossus muscle. It's the main muscle of the tongue. And what happened is they put a little device, a box under your skin here on your thorax. It senses at night when you breathe. They connect that to the nerve that contracts the tongue, and it moves the tongue forward during the night. You put it on, and the tongue moves forward and basically help to open the space in the back of your throat and treat the sleep apnea. It's for people who have moderate to severe sleep apnea, so not for patients who have mild sleep apnea. It's usually for people who cannot tolerate the CPAP machine for whatever reason, because they are claustrophobic or they don't find a good mask for them or whatever reason or psychological reason. So that's another option. It can help, you know, and decrease the number of times you stop breathing, but sometimes it doesn't correct completely the sleep apnea in some patients. And then also, once you have that, because it's something foreign in your body, you cannot have some like back MRI. So if you have like back problem or chronic back pain, it's something you have to think about, because then it would preclude you later from having a back MRI. But it's an option for some patients, and the ear and nose doctors, as some of them are highly specialized and do that. Not all of them do this type of surgery, but it's another option. But overall, and next slide. Overall, you know, the CPAP is the best treatment and weight loss. So to summarize, because I don't want to make it too long for you, but obstructive sleep apnea is the most common chronic sleep disorder. It still remains underdiagnosed. It's more common in obese people, which means if your body mass index is more than 30, that's how obesity is defined. It can lead to sleepiness. And people who are sleepy are actually, interestingly, more likely to develop cardiovascular complication from having untreated sleep apnea. Now with home sleep testing, you know, it's easier to test people. As I showed you, it's important to diagnose sleep apnea, because if you don't diagnose it, it can increase your risk for developing, you know, what we talked about, high blood pressure, cardiac arrhythmia, you know, stroke or diabetes. Losing weight is always helpful, but may not totally revert the sleep apnea, but CPAP therapy, it's the most effective treatment. There are other alternatives, as I showed you, with oral appliance or surgery, but that is more for people who have cannot tolerate the machine, or the oral appliance for people who are overweight is not such an issue and who have a mild sleep apnea. But if you have moderate or severe, usually, you know, then CPAP is the preferred treatment. And usually the surgery, this nerve stimulation, it is safe, less than 2% serious complication, but it's more reserved for people who have, you know, can't tolerate the machine. Because of course, you know, it's a surgery, so with any surgery, there are always risks. And then every 11 years, you need to have these wires that connect to the nerve to contract the tongue, needs to be replaced. So you need then, you know, surgery as well for that. So with that, I would take if you have any question, and I thank you for your attention.
So
I have a question.
Sure.
So I just what's sort of the sleep apnea, but for somebody's been somebody that's been suffering some sleepless nights, is how much does exercise play in a role of a good night's sleep in terms of like working out, you know, a couple hours before bed? How I read some studies on that like that's a key to a good night's sleep, but I didn't know if there was any study. I was just hoping you could
Sure. So
clarify that.
exercise, it's as we know, we understand more and more that exercise is very, it's very beneficial to your health. So not only to maintain a good weight, you know, a normal weight, or to lose weight, but it's also good because it seems to decrease inflammation. It also decrease anxiety, actually, because when you exercise, you release some brain neurotransmitters like serotonin that, you know, antidepressant medication, actually the goal of antidepressant medication is to increase your serotonin level, and you can achieve that with exercise. So it decreases anxiety, may improve your mood, give you more energy. So it's something very healthy to do. You need to do it during the day. You shouldn't do it just 1 hour or 2 hours before going to bed, because if you do it too close to your bedtime, then, you know, it gives you more energy, and then you will have harder time falling asleep. So it needs to be done during the day, but not close to bedtime. But it's something very beneficial, yes. And that's why they recommend that everybody should have, you know, 30 minutes of exercise a day.
Thank you so much. Appreciate it.
Oh, you're welcome. And as far as also for insomnia, you know, people, and I didn't talk about that today, except that, you know, as I said, some women who have sleep apnea present as disrupted sleep or insomnia. But so insomnia can have various etiology. It could be, you know, psychological, right? People who have anxiety, who have depression, or that can lead to insomnia. But they could be also medical causes, you know, like we know that some chronic disease like COPD, like cardiac failure can disrupt your sleep and lead to waking up and insomnia. People who have what is called the restless leg syndrome. So like they feel that they have like crawling, aching in the legs that gives them the urge to move them leg, and then they feel better when they move them. That could be also a cause of, you know, insomnia. So there are also medical condition, or asthma, you get, you know, worse at night, or wheezing, or if insomnia is what we call psychophysiological insomnia, then meaning that it's, you know, from anxiety or from, you know, this type of psychological reason, exercise is very important during the day. It's also very important to go to bed at the same time and get up at the same time, because if you change your bedtime all the time, your body doesn't know anymore when to sleep or when to stay awake. So a good sleep hygiene with regular bedtime, regular waking time is very important. The light is very important too. You know that when we, in the evening, we have increased melatonin secretion to prepare us to go to sleep. If you are exposed to very bright light, that will decrease your melatonin secretion, and then promote, you know, decrease your propensity to fall asleep easily. So the light is also very important. That's why also the blue light can disrupt your sleep, and you should avoid having any cell phone or screen time 2 hours, 1 or 2 hours before going to bed. You need to have a room that is dark and quiet. Also a little cooler, you know, because if the temperature is a bit lower, that promotes better sleep, we know. If you can't sleep and you wake up and you are in bed, and you shouldn't stay after 20 minutes in your bedroom, in your bed, and just toss and turn, because that then make it that you feel the bedroom is this bad place where you can't sleep. You shouldn't also look at the clock, you know, because that is also, you say, oh my God, it's 2 a.m. I'm not sleeping. I will be dead tomorrow. I have to work and go to work, and it will be awful. So don't look at the clock. After 20 minutes, get out of the bedroom, do something relaxing, again, very dim light, and go back to bed when you feel sleepy. And the next morning, get up at the same time, no matter how much you slept. and don't take naps during the day. And that will consolidate your sleep the next night. You will be a bit sleep deprived and hopefully have a better, nights of sleep night. Melatonin can help. If you have psychophysiological insomnia, cognitive behavioral therapy helps. And that has been shown, the study have shown it's superior to sleeping pills. Sleeping pills are not FDA approved for more than 2 weeks. And usually in my experience, people, I don't prescribe sleeping pill because people are very, they become very dependent on it. And then after it's very hard to take away from them. And again, cognitive behavioral therapy, relaxation technique have been shown to be superior to sleeping pills, and it's more healthy for you. And then, of course, don't forget that caffeine, everybody drinks a lot of caffeine. So Starbucks has the highest content of caffeine among all, the coffee places. And the caffeine effect can last up to 12 hours. So that's also something you have to remember. If you drink a coffee at Starbucks at 5 p.m., that's not going to be good for your sleep, for your night. Yeah. And then if you have a bed partner that snores, so we get a lot of this complaint. And that's why oftentimes it's actually the wife who brings the husband because say, my husband is snoring so loud, I can't sleep, help us. So that's how sometimes it comes to medical attention. Yeah.
This bariatric surgery, am I still muted here? The bariatric surgery,
Yeah.
The insurance companies, I understand, are very tough on it. What are their criteria?
Yeah, so the
With particularly younger people and older people.
Yeah, so it is also relatively safe surgery, but sometimes there can be complication like with any surgery. So people need to be oftentimes obese, and then they need to have tried weight loss and not succeeded. They first need to meet with a psychologist. They need to meet with a dietitian. And if they haven't succeeded, and if they have comorbid other medical problems, like if they have diabetes, if they have sleep apnea, so oftentimes then the insurance will, say we pay for that. And then these patients undergo a very, extensive workup. They get sent to us like they have diabetes and they're going to go for bariatric surgery. They want to make sure they don't have sleep apnea before the surgery, because as I showed you, 50% or 60% of people who are very obese will have sleep apnea. And sometimes they are not sleepy, these patients, they just snore and they can have sleep apnea. And it's important to diagnose before surgery, because when you get, for any surgery actually, but when you get, when you are put under general anesthesia, so put asleep completely, this medication they give you will worsen sleep apnea because they are all muscle relaxants. So they will promote collapse of your airways. And you are more likely when you wake up from the surgery to have like lung and heart complication. So to have your oxygen goes down when you are in the recovery room, because now you obstruct your airways and you stop breathing because of all the medication you got from surgery. And so we know that, it's important to treat the sleep apnea before surgery to avoid post-operative complication.
Yeah, but if they know people have sleep apnea, wouldn't they put you on a machine?
Yes, they will. Yes, and that's why they send us all these patients before surgery to basically screen them, evaluate them for sleep apnea. Yes, because being on the machine before surgery and then when you are in the recovery room decrease your rate of complication. Because there have been cases, rarely, but of people who, after surgery died in their sleep the one night after, It's very rare, but it can happen if they are not treated, yes.
Well, I had sleep apnea and had open heart surgery, and I brought the machine to the hospital.
That's great. So that's good. Yes. Yeah, and especially people who have bypass, things like that. And it's very important to continue to use the machine to decrease your risk of having worse coronary disease, Yeah, so that's good. Yeah, always tell if you are going to have surgery and you have sleep apnea, always tell the anesthesiologist, by the way, I have sleep apnea. They are supposed to screen every patient for that, actually, because of this higher risk of complication when you wake up from the surgery. But it's always good, in case they forget or they are busy, to if you have sleep apnea, to let them know, because they will monitor you more closely. And for example, people who have severe sleep apnea, sometimes they should be hospitalized when they have surgery. They shouldn't have that done in the, office, and they should be monitored more closely when they wake up. So even for, endoscopy, like people who go for, after 50 years old, people need to have a colonoscopy every 10 years, right? As a screening for colon cancer. People who have problem or the oxygen goes down when they have this, conscious sedation, we call it. So they get a little anesthesia, but they're not totally out. They're just a bit sleepy, so they tolerate better the procedure. But if the oxygen goes down during that procedure, that also is a red flag that they may have sleep apnea. That's what the studies have shown.
Thank you.
Are there any food or drinks or teas or anything that you think are good or bad before sleep?
Oh, it's a good question. There have been some research. They say, well, maybe, some herbal tea, but I don't think anything has really panned out. No. I think the main thing is to avoid caffeine and avoid having, doing exercise just before bedtime. And then all the good sleep hygiene rules I talked about before. And the light is very important.
Are there any other questions for us tonight? Well, I'd like to thank Dr. Rue again, and just hope everybody has a good sleep and learn some great tips tonight for yourself in your home life, and for maybe your spouse as well, or your partner.
Thank you so much again for inviting me. It was a pleasure.